So after surgery, you might be placed into what's called a hinged knee brace, and they call it a hinged knee brace because there's a dial on either side of the knee that acts as a hinge and allows the knee brace to actually bend. And there's numbers on the side here that represent the angle of flexion and extension in the knee. And so after surgery, you'll typically be placed in a post-operative dressing such as this. This is an ACE wrap that'll go from about the ankle all the way up to the thigh. And in some cases, you might have a compression stocking that goes from the foot up to the thigh, just depending on the particular surgery. So the things to pay attention to when you wear the brace are really the following. You want to make sure that the bars on the brace are really in the middle of the thigh. You can see here the front of her thigh, the back of her thigh. This brace is right here in the middle. You want the hinge to be right up against the knee, right about the level of the kneecap, and you want that right up against the knee. And then the bars down here along the calf, again, you can see the front of her calf and the back, and you want that to be right in the middle, right in between the front and the back, right along the middle of her leg right there. All right, so now we're looking sort of straight on to our knee brace after surgery. You can see our brace, you can see our post-operative dressing. You can see how the bars line up right next to the leg here. And you can see how the dials are right up against the knee, right next to it. We don't want the dials sitting way out here like this. We don't want the dials slipping forward on the knee. They need to be right there, right at the midline. This is just one type of brace that you can get after surgery. There are a lot of different companies that make a lot of different types of braces, and so they all have pretty similar features, and you can get the general idea of how each one of these braces work. So you can see here there's a little buckle. Quite simply, you can just unstrap it just like that, right up the leg, like so, and then you can really sort of just book the brace open like this. And so after you sort of get your brace straps adjusted, it's usually just as easy as popping it right back in, closing the book, just like that. Now when you first get your brace, you might find that these straps are a lot longer than you need. You can see how this goes way out. You can see this right here. You can let the leg come down. And so the Velcro strap is removable. They call these alligator straps. And you can find that the excess strap can actually be trimmed with a pair of scissors, and then you can put the alligator strap right back on. And so usually you want to cut it right here, put the alligator strap on, and then you can cinch and tighten it just like that so it straps down right in the front of the brace. If you would like or you prefer, you can just leave it right on the end, pull to tighten it up like this, but you'll just have to wrap the strap all the way around the brace so it fits in the back. Okay, so these are the dials on the hinged knee brace. You can see here extension, that's how much your knee will straighten. You can see here flexion, which is how much your knee will actually bend. And on this particular model, you have a little clip here, and quite simply you push this in, and then you can make that adjustment just like that. And usually this is set to 0 or even a little bit of extra extension or hyperextension to the knee, and that'll typically be set right after surgery. The amount of flexion can be dialed in by pushing this little tab in right here, and then you can rotate that dial around to whatever flexion that we've prescribed to you after surgery. Typically, we will have this set for full flexion with the brace locked. And so what does that mean? So if you look right here, you can see a little lock here, a little illustration. You can see the unlocked mark right here and the locked. This is easily flipped back and forth, unlocked, and then you pop it back on to the lock position. You can see the brace will not bend now. But if we pop it into the lock position, you can see how this will start to bend. And it will bend all the way down to 120 degrees in this particular case because our little dial is stopped right there. You need to make sure that you do the same thing on the other dial on the opposite side of the brace so that the brace bends properly. Now the final thing to point out is these little straps. Lift your leg up for a second. We'll undo the strap here. And like we said before, you can cut those straps shorter. We'll let this brace back down. And you can see you've got these little buttons, and this will allow adjustment of the sidebar for patients of different heights. And so to do that, you really, all you got to do is push this little button in like this, and you can see how that slides out, and then you can just move that on down depending on the patient's height, and then you can move it back, obviously, back down this way. Okay, and just like the dials, you need to make sure you do it on the other side and move it down the same distance so you don't have any differences in that.